Hi there, welcome to The Life with the Jacksons. We are here to share our experience, give you some feedback, and it has been asked from some of our viewers to discuss healthcare. So
Yes.
Here we are.
The elephant in the room, healthcare.
Oh gosh, it's so confusing, I'm not gonna lie.
It is, but once you understand it, it's not as confusing as you think. But
Absolutely.
Yeah.
And you know, the funny thing is that we've had to use it.
Yeah.
And when you get immediate care and you have the resources and you understand it, then it's easier to move forward. Keeping in mind that in the state of Texas, that's what we're primarily discussing.
Yeah.
Based on our experience, you have
Absolutely.
no state taxes. So your take-home paycheck is more, you're not paying out
Yeah.
as much taxes. Therefore, you use your money to buy your healthcare plans.
where you want to use it. Yeah.
For sure. No, okay, well, let's talk about our experience because when we moved here, immigration paper never went through.
Not
You were
yet.
pretty much a traveling man.
Yeah, I was on vacation.
Because I was a U.S. citizen already, my children were able to get the insurance from a provider. But let's take a step back here because we didn't know that that Leon could not get the insurance, so we went on a separate plan. And let's dive into the different plans here since we're on this subject.
Yeah,
So
absolutely.
we have private care here and
Yep.
you have public care. Now, when you're coming through immigration, you have to prove that you can be financially stable moving into the U.S. So most likely that you're not going to qualify for the public side just yet. Circumstances may change, but the likelihood. So I have my cheat notes here, but I will quickly just skim by what that is. There's Medicare. It's a federal program, and it's mainly for people that are 65 years of age and older, or people that are younger with a disability. There's 4 parts to it. So part A, you have the hospital insurance. So this covers you for inpatient hospital stays, cared skilled nurse facilities, hospice, and other healthcare services in respect to hospitalization. Then part B is medical insurance, and that covers for doctors, outpatients. Medicare Advantage, alternative to Medicare, it allows patients to get part or a portion of Part A and B coverage.
Yeah.
Then you have Part D, and that's prescription drug, which just helps with your prescription drug coverage.
Yeah.
Then there's Medicaid, and that is state and federal program that provides health care for very low income. So again, I don't think you're going to qualify for this right away, but it's something down the road that, if circumstances change, you may qualify for this. So we're going to talk about the private insurance because this is what we had to deal with. So let's dive into this.
So on the private health insurance side of things, there's an act called the Affordable Care Act, and it's a marketplace-driven model where there's health insurance exchanges where you can buy your different coverages based on your family's needs, your individual needs, that kind of thing.
Which we did.
Yeah.
And let me tell you, as soon as you click in there to say that you want healthcare, you're going to have everybody call you, everybody text you. It is annoying. So there's so many different providers, and you really don't know who to believe. And there's some really rude people on that end trying to really force you to pick a plan and to make a decision like that. And I'm recommending do not do that.
No.
So
do your homework.
Think about the plan, ask them to provide you with the information. Don't sign anything. Don't be pressured into it because you don't need to. Because there's some very nice people on the other side of that line as well. And so you get to pick and choose. You will have a lot of providers calling you. I'm going to back up because there's what you call open enrollment. So if you are already living in the US and you have all your immigration documentation is completed, you have November 1st to January 15th to enroll in that period for healthcare, and there's several healthcare providers, but that is your enrollment period, and you must enroll in there. However, there is opportunity, and it is called the special enrollment period.
Yeah.
The SEP, and it allows you to enroll outside that period. Again, Leon, because his paperwork was not completed, he couldn't do that. So
Yeah.
I ended up having myself and Carter and Ryder enrolled into our program, which we were able to pick the different kind of options. And it is, even if you have benefits with your company and they're not, enforced, or you have to get through probation, this will cover you for short term, which it did for us.
Yeah.
But again, look to see exactly what you need. You do not need to go and sign something immediately.
No.
You have individual and you have family plans, and they can cover you on a variety of health care, and you get to choose those. There's going to be base plans, and there's going to be all the bells and whistles. So you have to see exactly what's important to you, what it is. And there's some things that you need to look at that's going to be beneficial for you. But if you do have children, there is what you call a CHIP, and it's Children's Health Insurance Program, and it covers children for low-cost health care, coverage for families that earn too much to qualify for the Medicaid, but can't afford the private insurance. So you have support for your children.
Yeah.
That's really reassuring for you. There's also community health programs. If your spouse is working, you're able to go on their benefits. So look at that option as well. Up until the point in time that Leon's permanent residence kicked in, then he had benefits. But that is something to note, and it's different from our coverage in Canada. So Leon's going to take the floor with that one.
Yeah, so once I got my green card, I was able to become a permanent employee at the company that I was as a third party working with, and then you end up with employee sponsored health benefits, health plans, that kind of stuff. Couple different options for you. There's something called the HMO. I'm sure people have heard of that. Health Maintenance Organization, they call that. Your premiums are usually mid-range. Your out-of-pocket expenses are less, but with an HMO, you have a very narrow network of doctors and providers that provide the service for you. And you also need typically a healthcare provider, like a family doctor, in order to get a referral to see a specialist. The company that I have, we went with the PPO option, where we can go in to see any provider we want. We don't need a referral. We can just pick up the phone, do some research on our own, and go and see any doctor, any specialist we want at any time we want or when needed. And
which we have.
Yeah.
And the benefits are that if you do go out of that provider, that list, a lot of times you're not necessarily required to pay cash right up front when you're seeing that provider.
Correct.
They'll send you an invoice afterwards. Or if they do, you may have to pay, and there's that card, that debit card. It's like a bank card.
Yeah.
You want to explain that?
Yeah, so once with my company, there was two options. There was a health savings plan and a traditional plan. And we chose a health savings plan. And that plan is partially funded by, of course, myself with deductibles or deductions off my pay.
Like taxes.
Yeah.
Mm-hmm.
Kind of, yeah.
Yeah.
And then also my company provided some benefits to that as well.
Like a matching program.
Yeah. And that money went into what's called a health savings account. And I signed myself up, I signed Brenda up, and we both got a debit card. And as the money gets deducted off my pay and my company contributes it to it as well, that money is there forever. It's ours to use for any healthcare related expenses. If you go to the pharmacy, you pull out that debit card and that money's there, you use that. If you go to the hospital or anything and there's
or a naturopath,
anything, and you just use that card to pay for those expenses. So that's a very nice benefit of that health savings plan / health savings account. Other plans have what's called a flexible spending account, but you have to use it within the calendar year that it starts, or you lose it. So that's the difference. The health savings account gets rolled over; it's yours forever. Even if you leave the company that you're at, go somewhere else, you still have that health savings account. Those funds are there, and they're in the market, so they're gaining interest. They're building as you continue to contribute.
They're making maybe a little bit of interest, but you can invest it later on as long as that money is going to be used for healthcare.
Correct.
And the healthcare that you do spend, the money that you spend on healthcare is tax deductible as well. So you never know when you're going to actually need to use the healthcare expense. So it's nice to know that if you don't use it, it can carry forward to the next year.
Yeah, you don't.
Do you want to tell them that how the maximum works on a healthcare plan, so they know that they're not going to get that $30,000, $100,000 bill that they keep on people thinking that I'm going to be going bankrupt because of that. Yeah.
So insurance, like anything, just like your car insurance, you have a deductible. If you get into an accident, your deductible is whatever. It could be $1,000, $2,000. You get your car fixed, you pay that deductible, and you're scot-free. It's no different with the health side of things. The plan that we have, there's an individual deductible, there's a family deductible, and then there's what's called an out-of-pocket expense maximum for an individual as well as a family. For the individual, it's $3,000 deductible a year. For the family, it's a $5,000 deductible for within network. And then our out-of-pocket expense max is $9,000 as a family.
That's it.
That's it.
So when you look at your income and you look at the ratios of the percentage, $9,000 is not a lot, but you have to be sure to manage your money and know that money is going to be used for healthcare. That's why it's nice to have the healthcare expense, because that money is automatically going in there, and you know that you're going to use it. It's not use it or lose it either. So it gives you that peace of mind, right?
Yeah, and so whenever you go and access the health services that are within your network, and if you pay a bill, say it's $200-300, well, that money goes right against your deductible. So then as the year goes on, once that deductible is paid, basically your health insurance up to, once your $9,000 deductible is paid, your health insurance is 100% covered. So
most people don't understand what deductible is. And so it's just, just telling you, it works the same way. It works the same way. And I mean, the biggest thing here is that whenever you're getting any kind of healthcare, there's a few steps that we're going to suggest that you do. And so we're looking at our cheat notes here so we don't miss them. So it's important. Assess your needs. What's important to you? Are you on existing medication? Do you have existing health issues? Do you have children? What makes it important to you, and what will give you peace of mind? And that's the coverage that you should be looking at. But you cannot apply if you're not if your paperwork has not gone through. You will not get accepted.
Correct.
So just and that's what we've been told, and that's what we've been reading as well. So Leon had to keep on his Canadian insurance until it went through.
Check your eligibility for Medicare or CHIP. You visit the Texas Health websites and Human Services website to see if you qualify based on your income.
And then consider again for us the short-term insurance. Consider that in the interim. Don't be without. So look at what that's going to be. And I mean, for us, we had full coverage other than dental for myself and the kids, and this was full coverage. We were paying $700 a month for that. So, and I mean, but I just wanted the reassurance because the boys play hockey. I had the full coverage.
Yes, absolutely.
So, one of the things that that you should be aware of when you're applying for that is if you have pre-existing conditions or on any kind of medication, make sure you choose a plan that covers your pre-existing conditions. There's a plan out there. Look for it. Look at the cost. Do a comparison. Do your homework.
And also look where you're living and make sure that you have providers close by that are within the network.
Absolutely.
You don't want to be driving an hour to see a doctor.
Or 2 or 3
Yeah,
hours.
just because they're outside of your network,
Yeah.
which of course you can go and see those folks out of the network, but it's going to cost you more. So that, you know, be aware where you live, make sure you have providers close by that are within your network for whatever plan that you do have.
Absolutely. Like
Yeah.
here in New Braunfels, there's some providers that are here. They're mainly in San Antonio, so which is not very far from where we live, but the convenience is not there.
Exactly.
So, you know, look at that. Look at the co-pays. Look at the deductibles when you're looking at your premiums, and work with someone that is going to explain it with you. If it's someone that is pressuring you to sign,
Don't.
you know, over the phone, don't do it.
Well, no, because they're salespeople, and they need to sell those insurance plans to people, and they'll do whatever. Some of them are just rude, and they'll do whatever it takes to get that sale, because that's
Absolutely.
because they don't necessarily care about you. They're looking more about their pocket,
paycheck.
their bottom line. So just be aware of that and do some research.
Yeah, there's, you know, because you call in, you give all your information, and once all your information, when you call in there, then, and they press enter and submit, that's when you get your call. So I hope this is helpful. If you have any other questions or comments, or you'd like us to cover additional information with the healthcare or any other items, let us know. We're happy to share our experience. We'll have some links down below that we'll share with you. And for now, I look forward to connecting with you. Let this life be our best life.
Don't forget to subscribe and like and share with all your friends.
Absolutely. Until next time.
Take care.